What's up, guys? Today we want to talk about why physical therapy works. I have a really inquisitive patient, and he asks really good questions, and we're dealing with his shoulder, and he said to me, Kel, how does physical therapy stop me from having surgery? And the simplest answer I could give him has to do with this right here. Right, so how does physical therapy work? To oversimplify it, it's a really complicated process, right? But to oversimplify it and put it in terms that people can actually understand, there's one thing you really need to know, right? And that one thing is the phases of healing, we call them. So say an injury happens, right? I like to give the example of an ankle sprain because a lot of people have been through that, right? So say an athlete gets an ankle sprain, or somebody, right? You step off the step funny, you twist your ankle in. Immediately, what happens is your body recognizes something went wrong here. Like, what was that? Right? And it sends signals down to that area, and think about those signals like the first responders, right? The police, the fire department, the first aid squad. They rush down to the area and they say, what happened here? Right? And they kind of assess the damage. So they get down there and they say, okay, is there bony damage, right? Did we break a bone down here? Is there ligament damage? Is there blood vessel damage? Is there nerve damage? Is there muscle damage? What are we dealing with, right? Let's figure out first what we're dealing with. Depending on what's damaged, your body then responds with usually a pain signal, right? If there's bony damage, most of the time people can't walk on that ankle. And that's the body's warning signal to say, hey, could you not mess this up anymore? We're already hurt, right? If you try to put weight on this bone, you are going to make it worse. We can't put weight on the bone, right? And that's, some people stand up and they can't walk on it. If there's other tissues involved, right, say it's muscle or say it's ligament involved, the body says, all right, you can put weight through this because the bone can handle it, because the bone is not the thing that's damaged, but please don't put a lot of weight through it because the ligaments or the muscles and other tissues down there, those have been compromised in this recent accident, whatever it is, right? So that happens within minutes. And that's why we get that inflammatory response, right? One of the things that goes down there is histamine, right? And histamine causes the swelling and inflammation that we're so familiar with, and often in like allergic reactions, that kind of stuff. So those all go down there and they respond, right? That's why that first day or two, things are swollen, things are painful, because your body's still figuring out what the heck happened down here, right? So that's what we call the inflammatory response. It usually lasts between 1 and 4 days. As that's going on, and they kind of mesh together, these phases, right? The proliferative repair phase happens, right? And that's just a proliferative means pro-life, right? Creating new things. So your body starts to lay down and it says, well, let's start fixing this. We don't know exactly what went on here, but we know we can't live like this forever, right? So let's start fixing this. So it sends down, think about it like the concrete pourers, right? And it doesn't really have an architect yet, but it says, well, all right, well, we gotta design something down here. So it starts to throw in, the plumber and the electrician and the people who are gonna, or the structures rather, because they're not people, the structures that are gonna help the tissue repair itself. Okay, and that lasts between 2 days and 2 months. That can go on for, right, where the body's just laying down new things, right? And it's kind of putting them in there randomly, because its philosophy kind of is like, well, it's better to have it done than have it be perfect. If we were going to do it perfectly the first time, it would take us a lot longer, and we don't have that kind of time. That's where the remodeling phase comes in, right? And that lasts between usually a couple weeks out after the proliferative phase has done its thing, up to a year. So you often get people who are still in pain, or still uncomfortable, or still can't do certain things up to a year after this thing happened. And that's where a lot of people come see PT, because they've said, well, maybe it'll go away after a month, or maybe it'll go away after 2 months, or maybe it'll go away after 3 months, and it's still bugging them. And that's where we come in, right? That's what a lot of the profession does, especially when we deal with musculoskeletal issues. So that's that remodeling phase. So that's a long-winded answer, and this poor guy, I'm working on his shoulder as I'm explaining this all to him. But that's why the physical therapy works, right? That's how we know the phases of healing. Depending on the person in front of us, we know where they're at in those phases of healing, right? And then we assess what is the appropriate load to get this tissue into the appropriate remodel, right? Because remember, in the proliferative phase, it all just goes down there, right? You get the electrician, you get the plumber, you get the concrete guys, you get the the window guys in, right? You get everybody down there, and they just start going to work, right? And they start hammering, and they start putting stuff down because they're saying, well, somebody needed us down here, so we better get to work. In that remodeling phase, that's where it takes some skill, right? And your body sends other signals signals is the best word for it, down there to say, all right, good, we got all the material, it's all here. Let's make it all work together now. Let's make a nice house out of what we have down here. We got the wires, we got the concrete, we got the bricks, we got the window, we got the chimney, we got it all. Now we have to make it pretty, right? Now we have to make it functional. And that's often why loading it, right? And often, like, if we do soft tissue massage to an area, or that's why the exercises in PT help, and they should help, right? Because we're asking that tissue to remodel itself. So that's kind of a long-winded answer of why physical therapy works. If you're in PT and you're like, what the heck do I have to do this for? That's why. If you're confused, or if your PT can't answer that question, or you should be able to ask them, like, hey, like, why are we doing this exercise? Why are you having me bench press? Why are you having me deadlift? Why are you having me do this band exercise? Right? The answer that I always should be able to give my patients is we're remodeling the tissue down there. We have to strain it. We have to ask it to do certain things to get it to absorb the forces that your body's going to ask of it in the right way, with the right amount of stress and strain, and not doing so much where we hurt it and we go back to phase 1, and not doing too little where we don't make any changes in phase 3. We have to kind of strike that gold and find the right resistance in the right spot for you. So if that helps, just drop me a comment and say, like, hey, like, I never knew this before. Or if you did know it before, you learned something new, or there's something that I got wrong, which is entirely possible. Drop me a note. I'm happy to help in any way, and hope you guys have a great rest of the day. Thanks.